In this video, we are going to talk about some common things to expect as you heal in the postpartum. I'm going to start with bleeding and uterine involution, which is how your uterus contracts and returns to its pre-pregnant size. So you will bleed from your vagina after you have your baby. This happens after a vaginal delivery or a cesarean delivery. Your uterus needs to close off the blood vessels that were supplying the placenta. Your midwife will check where the top of your uterus is after you have your baby during visits in the postpartum. It takes about 6 weeks or so for your uterus to shrink back to its pre-pregnancy size. You will notice a big difference right away after you have your baby as it goes from under your ribs to under your belly button. Typical bleeding in the first couple days or so is bright red and like a heavy period. You may pass some clots in the first day. Your vagina is pretty elastic, and if you had a vaginal birth, it has stretched to accommodate your baby. If you are laying down for 4 hours then and you stand up, you may pass a clot that formed in your vagina or have a gush of blood from the blood that was pooling there, and that's okay, as long as the bleeding doesn't continue to be that heavy. You can pass one clot that's the size of my fist, and you may pass a bunch of tiny clots. But if you are passing repeated fist-sized clots, or you are filling a pad front to back, side to side in less than an hour, please page your midwife. I would also want to know about any foul odor or increasing consistent abdominal pain. Sometime in the first or second week, your bleeding will change and start to become more pink or brown before turning to a whitish yellow discharge. Sometimes people experience a short and sudden recurrence of heavier bleeding in the second week as the covering from the placental site comes off. This shouldn't last more than a couple hours, and you should still not be filling a pad in less than an hour. How long you bleed is different for everyone. Some people are mostly done after 2 weeks. Others may still need a panty liner for 6 weeks. Things that can impact how heavy your bleeding is include your activity levels and your bladder. If you are running around your house after a toddler, for example, or to go to the store for something, you may notice that your bleeding increases. This is because you are not giving the muscle fibers a chance to close off the bleeding to the site where the placenta was. Try to listen to what your body is telling you with increased bleeding and take a step back in your activity if you can. If your bladder is full, it takes up space in your pelvis and doesn't let your uterus contract down effectively, and it can also increase your bleeding. My recommendation in the first couple of days when your bleeding is heaviest is to go to the bathroom before you feed your baby every time. This makes sure that you are emptying your bladder frequently and not forgetting and then being stuck on your chair with a full bladder because your baby finally fell asleep skin to skin and now you just can't move. As your uterus contracts down, sometimes you feel crampy. These are called after pains, and you typically feel them more strongly with each subsequent baby. Often people feel them as they breast or chest feed, as you get a spike in oxytocin. This hormone plays dual roles in causing milk letdown and contracting your uterus. Keeping on top of your Tylenol and ibuprofen are a great idea. Both are safe to take and they can really help with these after pains. I usually recommend that in the first couple days you take 1,000 milligrams of Tylenol and then 3 hours later take 400 milligrams of ibuprofen and then just keep alternating them out. This way you have a good spread of your pain meds and you don't go over the recommended doses for either of them. Please only use external pads during the first 6 weeks postpartum as your body heals, so like no menstrual cups, no tampons. In the first couple of days when your bleeding is heaviest, I like adult Depends. They are just more comfortable and you get full high-waisted coverage without worrying about pads slipping anywhere or getting stuck places they shouldn't be. If you have stitches, try to avoid pads that have a plastic coating on the top and go for the cotton-topped ones. They should say this on the box. I am also a big fan of reusable products. Especially now when you may be bleeding for 6 weeks, it might be a good time to invest in some reusable pads. You save money in the long run, they are better for the environment, and honestly, I think they're just more comfortable. I've linked some of my favorite period underwear as well as some reusable pads with sharks on them in the description because I think that's funny. But if you're going to use reusable products, I recommend using them after the first couple of days once your bleeding has slowed down a little bit. Next up, stitches. I talked a bit about tears and episiotomies in the common interventions video, but here we are going to review how to care for them as your body heals. So the stitch material that we use is dissolvable, and it usually comes out on its own within 1 to 2 weeks. You may notice some stitch material come off when you wipe or in your underwear, and that's fine. Your midwife will assess your perineum as needed during your postpartum visits. I want you to protect those stitches. No running up and down the stairs, no sitting cross-legged and putting extra pressure on them. I want you to keep your legs glued together and sit like a mermaid. For the first couple of days, try to camp out on the same level as your bathroom. When you pee, you can use the squeeze bottle that you got in the hospital or that was provided to you by your midwife to spray water. Spraying while you pee keeps urine off the tear and helps reduce stinging, and spraying after you pee can be used instead of wiping to clean the area. If you want to dab the stitches dry afterwards with toilet paper, that's okay, but just a gentle dab. If you have grazes or small tears into your labia, you can put Vaseline or polysporin on them to stop them from healing together, but for tears into your perineum or vaginal wall, just leave it alone. You can do herbal baths or sitz baths with Epsom salts if you want, but many people find these to be irritating to their delicate and healing tissues, so I don't routinely recommend them unless you are having difficulty healing. You can use ice packs in the first day or so to help with swelling, but please only keep the ice on for about 15 minutes and then take it off again for at least an hour. As the swelling goes down and your tissue heals, you may feel the stitches tighten or pull or become a little itchy. This is normal as they heal. Sometimes you may have a knot in the material that is causing irritation. This usually comes out on its own after it's done its job to bring your tissue together, but if it is sticking around after a couple of weeks, your midwife can cut it out for you. If you have increasing pain, pressure, and tenderness near your stitches, or you notice a foul odor, please page your midwife. Something else that is a good tip about stitches as well is when you sit, I want you to clench your bum muscles, then sit down, and then relax them. It just reduces the spread of your tissue and the pressure on those stitches, and it can make you a little bit more comfortable. Talking about stitches in the perineum, this now leads me to going to the bathroom. So, as we have established with helping to reduce your bleeding, it is important to go pee frequently in the postpartum, but frequent urination also is important in reducing over-distension of your bladder or filling it way too full. In the immediate postpartum, usually around 2 hours or so after you've had a vaginal birth, your midwife will help you go to the toilet. You will probably not feel like you need to go pee, and this is because as your baby is born, the nerve endings by your urethra can get a little bit bruised. And honestly, there's a lot of sensations going on down there at that time, and that can be distracting. But if you don't pee, your bladder can get over-distended and full, and it can lead to bladder dysfunction if this becomes a habit. So go pee. If you can't pee, try smelling some peppermint essential oils, running a tap and listening to the water, or blowing bubbles through a straw to help relax your pelvic floor muscles. On the other side of things, sometimes people find that they develop urinary incontinence in the postpartum, where they are not making it to the bathroom in time, or they pee when they sneeze or they laugh. Again, keep your bladder empty by voiding frequently. But this is really where pelvic floor physiotherapy is your best friend. Actually, in general, pelvic floor physio is amazing after you've had a baby, as they can help with everything from back pain to rectus diastasis to vaginismus. Go after about 2 to 3 months postpartum. People are always nervous to ask about their first stool postpartum. Your body will give you a couple days to heal before this happens. Keep yourself very well hydrated to avoid constipation. You can take a gentle stool softener if you do experience constipation, like Metamucil or Colace. Your stitches will be fine. If it makes you feel better, you can take some folded toilet paper and hold it to your perineum to provide some gentle support and counter pressure. Healing from a cesarean section birth also deserves its own little talk. So it takes longer to heal from a cesarean section than it does from a vaginal birth. It's major surgery. Please be patient with yourself. If you had major leg surgery, you wouldn't be expected to run around all day doing your normal activities, so give yourself some grace there. After the surgery, you will be transferred back to the recovery room where you will learn to feed your baby and your vitals will be monitored. You will have a urinary catheter in for a few hours, so you won't have to worry about getting out of bed right away. You won't be able to eat right away, but we'll start slowly with ice chips and then water, and then after a few hours, food. Your nurse will encourage you to start walking slowly within the first 24 hours to help with gas and healing. You usually stay in the hospital for 2 days. Once you are home, it is important to take it easy. You cannot lift anything heavier than your baby, exercise, or drive for 6 weeks to avoid strain on your healing abdominal muscles. Your midwife will assess your incision at your postpartum visits. Usually they use a dissolvable suture material, just like with the perineal stitches, but sometimes they do use staples that will need to be removed by your midwife. You may have some bruising around the incision, or it may feel tight or numb. And that is all normal. If you have any oozing, fresh bleeding, swelling, increased pain, or a fever, please let your midwife know. So I think we've established that your body undergoes some big changes after having a baby. You are healing after creating a new person, and for many, you are continuing to sustain this little person with milk from your body. That's a lot for any body to go through. Take some time to love and appreciate the job that your body is doing and allow for kindness and patience. We do focus a lot on the changes to the body in the postpartum. It's what we can see. It's what people understand externally. But the mind also goes through some big shifts as well. Your brain chemistry is impacted by the way your hormones shift in the postpartum period. You are running on an altered sleep schedule. Your relationships between your partner and your supports are changing. And one that I don't think gets enough attention, you are going through a big shift in your identity, and that is not easy. The postpartum is a vulnerable space to be in, and a transitional space filled with a lot of change. So for your mind, I also ask that you allow for kindness and patience. Many people feel teary or anxious with a new baby. I tell my clients that when your milk comes in, often your tears come in too. You've just created a new person who is pretty defenseless. You'll feel worried about them, and you'll want to check that they are keeping up with that new skill of breathing on their own. And that's normal. It will be like a roller coaster. You will have ups and downs and great moments and bad ones. What is not normal is if you bottom out, or you were only having the low moments, or you are feeling increasingly numb or disconnected, or if you are having constant intrusive anxious thoughts that are reducing your ability to function. What we are talking about here is postpartum depression or anxiety, and it can look very different to different people. About 20% of people experience postpartum depression or anxiety, and it can occur anytime in the first year, but it's the most common in the first 3 months. So, some important things to remember: it is a medical condition that may not go away on its own. However, it is also a very treatable form of depression and anxiety. The best treatment for postpartum depression is medication that you have responded to positively in the past. If you do not have a history of depression or mood instability requiring medication, an SSRI may be prescribed by your doctor. SSRIs are common antidepressants, and they are safe to take when breast or chest feeding. You can also join peer support groups and see counselors or therapists. So if you are feeling like you may be suffering from postpartum depression or anxiety, please talk to your midwife or someone you trust. There are many avenues that you can pursue. I have linked some great resources in the description below. Okay, moving on to activity. So having a baby is hard work. You will feel like you just ran a marathon. You will be stiff and sore and tired, and your hormones are doing crazy things. I recommend taking things easy after you've had your baby, especially in the first couple of days. Minimize how much you're up and about. Try not to run up and down the stairs. I mean, everyone's home situation is of course different. And while one person may get to stay in bed with their baby while their partner brings them food and rubs their feet, another person may have to care for older children while their partner is at work, or maybe solo parenting and things need to get done for the house to continue functioning. Just be patient with yourself and don't do any unnecessary activity while your body heals. If you're going squirrely inside, then maybe a walk around the block in the sunshine is necessary activity for you. And that's fine. Just take it slow and work your way up to the activity that you want to undertake. Pay attention to your bleeding and how your body feels. Please remember that if you go out for a walk, you start to turn back around when you feel like it's been too much, then you have to walk all the way back like that. So maybe start out with half the walk that you want to and see how it feels. As you heal in the postpartum, you know your body. If you want to start slowly introducing activities, that's great. Start with low impact exercises like yoga or swimming, and then work your way back up to the activity that you were doing either during pregnancy or before you were pregnant. And then what's another type of activity that people have a lot of questions about after they have babies? Sex. So this is a very personal choice. We have reviewed the normal healing process postpartum, so you get some of the physiology behind what's going on in your body and how you may feel. I don't like to prescribe when it's okay for you to have sex for a few reasons. Number one, it's your body. You may feel ready after a couple of weeks or a month, and hey, good for you. I highly doubt that you are going to feel ready when your stitches are still healing or your bleeding is heavy, so that's a self-limiting factor. Just pay attention to your body, go slowly, and use lubrication. And number two, it's your body. Just because someone tells you that after 6 weeks you are okay to have sex again doesn't mean that that is true for everyone. Again, pay attention to your body and go slowly, and have sex only when you feel ready. Commonly, 6 weeks is when people feel physically ready, even if they are not mentally or emotionally ready. Also, please remember that you ovulate before you get your period. Breast and chest feeding does delay your fertility, but it is very unreliable, and I have no idea when you are going to become fertile again. So, if you are having sex and semen are involved, use some form of birth control unless you are hoping for babies very close together. If you have had a cesarean section, please check out the VBAC video for more information on spacing of pregnancies. And on to diet. You are no longer pregnant. Yay, eat whatever you want. Seriously. I mean, eat healthy, but go for that sushi that you have been dreaming about for the last 40 weeks. You can have a glass of wine. I mean, foods high in nutrient value are still a good idea. Keep up those good habits you created in pregnancy. Sometimes people will worry about what they eat in relation to chest or breastfeeding. For example, if I eat this thing, it makes me gassy. Did it also make my baby gassy? The answer is no, it did not. You make milk out of your blood. So while you may pass on nutrients to your baby that way, they do not have to break down the food themselves to release the nutrients. Babies are just gassy as they get their digestive tracts up and running. Don't restrict yourself from that delicious thing just because your baby's having a fussy day. There are some molecules that do enter your blood that may impact your baby, like caffeine and alcohol. I'm not saying don't have your cup of coffee. I would never say that. Same rules as in pregnancy apply. 200 to 300 milligrams a day is fine. Some babies are just more sensitive to it than others, same as with people. So if you are finding this is an issue, you can adjust the amount or the timing of your caffeinated beverages. As for alcohol, as you make milk from your blood, the alcohol content in your milk will mimic the alcohol amount in your blood. It takes the average person about 1 hour to metabolize one drink. So, if you want to have a glass of wine, have it right after you feed your baby. That way, by the time you're feeding again, you have metabolized the alcohol out of your system. If you have 6 shots of tequila, that is a different story. Pumping and dumping is a myth. You will have alcohol in your milk for as long as you have it in your blood. You can pump to relieve your full tissue if you need to, but you will have to wait until you are sober to feed your baby. As far as drugs go, like actual medications, how safe they are with chest or breastfeeding really depends on the size of the actual molecule, and we take that at a drug-by-drug basis. So ask the person who prescribed you the drug what the impacts are on chest or breastfeeding. And you can also take a look at the mother-to-baby fact sheets, which is a really good list of common exposures in pregnancy and postpartum. And the last one that I am going to talk about is visitors in the postpartum. The first couple of days or even weeks with your baby are not the time for you to entertain people. Seriously, you just had a baby. You can have people come to support you. They can hold the baby while you shower, or make you dinner, or do your laundry. My favorite is when I go to a home visit and people have just left care packages on the front step without bothering the family. But if someone wants to come and visit just to meet the baby and sit in your living room while you serve them tea, that's not okay. I get it. Babies are great and new babies are exciting, but this is an important and demanding time for you. Do your best to set up boundaries that you feel comfortable with and ask people that you trust for help and support. Take the advice that you find helpful, and for unwanted advice, just say, thanks, that's great, and then do what you want to do anyways. I hope that you found this video helpful as we talked about a lot of the common ways that you're going to heal in the postpartum. Your midwife will provide you with lots of information and support, and as always, I have linked a ton of resources below in the description, so please take a look for more reading.